Hi, I'm James Sutton. This is Road to Recovery. And my special guest today is Ben Stevenson. He's the manager of harm reduction services for Health and Human Services in Montgomery County. Welcome, Ben.
Thank you, James. Thanks for having me.
And he's one of the nicest guys I've met since I've been working at Montgomery County. And I'm sure you guys are going to see the same thing. So, Ben, what brought you to Montgomery County and the field that you work in?
Interesting enough, I'm originally from North Carolina, Winston-Salem, born and raised. Um, I, been in the field for a little over 17 years. So I initially started out in prevention. So working as a substance use prevention specialist in North Carolina, educating young people and families about the dangers of substance use and stuff like that. And got exposed to, working in treatment for a little while. And then, ventured back into prevention and started doing a lot of harm reduction and research. So initially I started with Montgomery County with Department of Corrections, working as a correction specialist in their diversion program. So the IPSA intervention program for substance users, it used to be abusers, and then kind of got tabbed by HHS to come over and do prevention work for the county. So I've been doing that in total probably the past 8 years totally. So yeah.
Right. And I didn't know you worked for IPSA, but
Yeah.
when you took over prevention, I still use the slides that you put together for the Narcan demonstration. And I became a Narcan trainer,
Right.
and you're the one that actually put the training materials together that we use in the jail today.
Oh wow, that's interesting.
I need you to update.
Yeah, so those have been updated. Wow, I think we might have updated it at least twice
Did you? Okay.
since then. So we do have some definitely updated slides and more information and stuff like that. So
Right. Good. Well, you need to send it to me
uh,
so that I can have the most current version of
of
your
course,
presentation.
we'll do.
Right. As a matter of fact, a young lady in the jail today asked me, could I train her? Because during COVID, we haven't been doing any training.
Yeah.
And now we have started giving out Narcan in the lobby again. And
Okay.
we give out a lot Narcan to inmates as they're discharged, but we haven't been doing any training because we couldn't mix people, right?
Right. Right.
So
Yeah. I
now
know.
they are asking me to train individuals, and hopefully not too far in the future, we'll be able to train groups also.
Okay. Yeah, we've moved to a virtual space, so all of our Narcan trainings are provided virtually. Except for when we do like community outreach events, which we've started doing a lot in the past few months. We are, and then we do have I have a couple staff members that actually do some street outreach efforts in some of the hardest hit areas of the county, walking up and down the street with
Oh, wow.
backpacks full of Narcan, and they will train people on the spot and provide them a kit on the spot.
Oh, wow. Good.
So we've been doing a lot of that lately too, just trying to one, saturate the community, but also just trying to make sure that everyone is aware that, regardless of what you look like, you're not immune to, potentially being in a position to save a life. So just trying to train as many people as possible.
Fantastic. Fantastic. Yeah, I know that I've had reports of people in going to Starbucks bathroom to find a person
Yeah,
overdosed, and
yeah,
7-Elevens, of course, and gas stations and places like that where it's isolated.
yeah,
But yeah, it could
mhm,
happen anywhere. Yeah, I
yeah,
agree.
yeah,
As a
yeah.
matter of fact, we're having a Tree of Hope is having a retreat in September,
Mm.
and we would love for you to come out and send somebody out and do outreach and do Narcan
Yeah,
distribution at our retreat.
yeah,
The
definitely.
last one we had, I think somebody came out from HHS.
Oh, okay. Yeah,
Yeah,
definitely let us know. We would love to come out, set up a table, provide education and Narcan and any other information we can share.
Now, let me ask you this: with the street outreach, is that just Narcan and information on where they can get treatment, or do you do do you do syringes too, or kits? I think safe
So
injection supplies.
so we have done safe injection supplies. Currently, our programmatic setup though is considered like a fixed site. But just because of COVID, there's been situations where you want to minimize the amount of contact. So we have been in instances and situations where we would actually deliver supplies to a client who might
Oh
be in need
wow,
of different supplies and things like that. So my team, even myself, I've gotten out and delivered supplies to different places and things like that. So um, m- my harm reduction specialist that's on staff, they will carry supplies with them. But we have learned that, particular different clients like various needle sizes and gauges and things like that. So sometimes it might be hard to have what they want on spot. So we'll kind of figure out what they like or figure out what they need, and then we'll circle back. They'll go back to the office, get whatever they need, and then meet them somewhere or drop it off wherever it needs to be dropped off. So
right. And
mhm.
see, I'm from DC, and I'm familiar with DC and Baltimore. There are different
Yeah,
areas that are just street corners that you
yeah,
can go, and it's like a marketplace where people
yeah,
buy, and there's a lot of concentration of people that are IV drug users.
yeah.
Montgomery County, how does a person that's a IV drug user, how do you find them, or how do they find you?
Yeah, so a lot of it has been one with the harm reduction staff that's been going out in the community doing outreach. So just various areas, partnerships with a lot of organizations that engage with persons who use drugs. So if they've identified a client who might be in need of services, then they'll do a direct referral to us. In addition to like we built partnerships with the homeless shelters in the county, just because they've identified clients who are dealing with as or identify clients as IV drug users and things like that. We have attended various festivals, different events, just trying to um, just engage with people. And then a lot of our clients that we have obtained have been by word of mouth. So we kind of felt like, if we're able to, be like a non-judgmental, compassionate environment that, a person could actually feel comfortable and get services, they may tell someone, and that has happened quite a bit when people say, hey, I learned about this from my friend who is a client here. So, because we're very big on trying to keep in persons, you know, um, identity separate from the program. So.
Right. And what do you tell the person who says that you're helping people use? So I mean, you're actually contributing to the problem by giving them syringes and safe injection supplies. So what do you tell the person that hasn't been educated as to what harm reduction services is?
Yeah, so mainly I try to let them know that harm reduction mainly just kind of tries to mitigate like the negative consequences that a person may experience from their harmful behavior. We're not necessarily focused on trying to stop them from using, but we're focused on trying to eliminate any of those negative consequences. So the contraction of any like diseases or viruses, support on their well-being and health, just because we feel like and also trying to eliminate overdosing, just because I mean in our county we've seen that pretty much over about 70-80% of all of our fatal overdoses have been related to fentanyl. And so we can feel if we can engage with those clients and build rapport with them and kind of just be a support to keep I kind of feel like it's like keeping them alive, keeping them safe, um, and hopefully get them to a place where they may eventually pursue their treatment and recovery. I mean, harm reduction has been shown across the country to be a viable entry point for a person to potentially, pursue their treatment or recovery. So it's not really about like helping them to use, but it's helping them to be safer, and hopefully sustain their life until they're ready to take that journey to pursue their treatment and recovery.
Right, right. Thank you. Yeah, I know that harm reduction, I looked at a while back some of the evidence, some of the data
Mm.
in other countries, and they were some things that were interesting. I never thought about it. Was saying like there's been a reduction in syringes found in playgrounds and
Mm.
parks and places where children are often,
Yeah.
public spaces where people use and then leave those, dirty or tainted, syringes in
Mm.
the sand and different things like that. And they had a tremendous reduction once they started doing syringe exchange.
Hmm.
Uh, and then there's two different ones. One is syringe exchange, and the other one is something else where you don't necessarily give a needle for a needle. You just can come in and get needles. You don't have to
Yeah.
turn in used ones.
Right, right. And that's how our program is set up. So you don't necessarily have to turn in needles to get needles from us. We typically give a minimum, like we working out, our protocols and procedures, we typically give a minimum of 50 needles at a time. And that was just something we had put in place around related to COVID. But we also do collect needles to try to dispose of them in a safe manner, in addition to providing other supports and things. So like we have a nurse on staff that provides wound care services, so educating a client not only about taking care of their wounds themselves, but she will also go through the process of caring for different wounds and things like that. And then we also provide free HIV testing. We are connected with public health, so our partners in public health also provide Hep C testing, so we can make the referral to that space. But like a lot of times when people think of harm reduction, they only think about needle exchanges and syringe exchanges. But I also try to educate people that harm reduction is throughout, embedded throughout our lives, in a lot of different things. So if you're going to the beach and you're putting on sunscreen, that's harm reduction, right? When we wear our seat belts in the cars, they put that a little alert to let you know, like, hey, you need to put your seatbelt on. Once you put that seatbelt on, that's harm reduction.
Right,
Speed limits, filters on cigarettes. I mean, it's a lot of different things that you could look at are actually harm reduction practices, but we don't think about those. We only think about the harsher, drugs when it comes to harm reduction.
right, right. Uh, we're gonna take a break in about a minute, but when I come back, I want to ask you more about some of the services
Okay.
and how well are you doing with the working reducing HIV in Montgomery County?
Mhm. Okay.
So when we come back from the commercial, two things we want to talk about: the HIV numbers and also the overdose numbers, because I went to the overdose ceremony in Frederick,
Mm.
and it was and most of the pictures of the people who had passed last year were young people. They were between 18 and 30.
Yeah.
And then, like you said, it's probably the fentanyl in Frederick, and I'm sure Montgomery County is the same thing. I didn't go to the overdose ceremony we had in Montgomery County this year because I was in the Frederick one. But when we come back, touch on that for me, okay?
Okay. Okay.
All right. We're going to take a break right now, and then we'll be right back with Ben Stevenson.
If I could be you, and you could be me for just 1 hour, walk a mile in my shoes, walk a mile in my shoes.
I'm James Sutton. Welcome back to Road to Recovery. My guest today is Ben Stevenson, the manager of Harm Reduction Services for Health and Human Services in Montgomery County. So, Ben, how are we doing in Montgomery County with reducing HIV, new infections, and what population seems to be the new population for new infections?
Yeah, so I know as far as HIV testing for the SSP, our focus is on persons who use drugs or use IV drugs and things like that. So that's a big population of focus. And when we started the SSP program, and our partners in public health learned about us starting the program, they wanted to partner more because that's one of their main initiatives in Montgomery County is ending the HIV epidemic. And so but just because there have been data showing that Montgomery County, there was a surge of increases of HIV cases in Montgomery County. So I know they're doing a lot of work around, the LGBTQ plus community. We're working in the space of working with client persons who, inject drugs intravenously and things like that. As well as just kind of educating people about, safer sex practices, and things. So just and one thing about a SSP is it can be used as like an entry portal or a place to connect people with services. Just like we're able to provide the testing portion of it, but once we provide testing, if a person tests positive, then we make a referral to public health, which is the Dennis Avenue location. And they'll provide the counseling and the supports, education and things and treatment supports and things like that. And based on like data from like the CDC, like it has shown that SSPs can help in, the reduction of or the decline of the risk of HIV transmission, just by, having a program in place with those, various services and connections built in. So I think we're, able to, catch a population that they may not directly connect with on a daily basis, which I think is helping the whole situation. I'm not too aware of all the specific numbers around HIV in Montgomery County, but I can definitely connect you with the person that I lean on when it comes to that HIV discussion. So which is a great partnership I think we have in behavioral health services and public health services.
Right. Yeah, it is a great partnership. You guys are doing a great job in your area, in your department, and then the initiative to end HIV in Montgomery County.
Yeah.
I think they're doing a great job too. What about how are we doing with fatal overdose during COVID?
Yeah, so I know our numbers from 2020 were higher than the previous year, just because I think it was a lot of people just scared to access services, but use wasn't necessarily stopping. People were still using during COVID, and so we saw a jump in our numbers, and then even in FY21, I want to say we also saw a jump in numbers, and so we were very intentional about just trying to reach people where they are, just trying to find, where they are, get them connected with services. It was difficult getting like the SSP up and running during COVID, just because, trying to hire the right people, figure out location of where the services will be provided. So we finally got settled into the 1500 East Gould Drive office, which is co-located with the county's MAP program, the drug urinalysis program, and I think drug court services over there as well. So we've been, able to kind of, foster that partnership, working with them. And then I think just it's just been, it's been a slow, kind of like a slow grind in a sense, just trying to, get connected with clients, get client services, realizing, hey, some clients might not be able to get to us, so we're going to get to them. So that's why we kind of implemented that whole, hey, we'll kind of do like a brief assessment via phone, and then we'll, drop supplies off to you at your home or whatever location that they decide. So.
Right. Yeah. Anytime you have a new program and you guys started during COVID.
We started during COVID. So
Yeah, that's a challenge.
yeah,
That's a real
yeah.
challenge. Yeah.
Yeah. So
Yeah, I
it's
know. In Baltimore, I've met, you know, teams of guys and women that go through the alleys with backpacks,
mhm,
you know, with safe injection supplies and wound care stuff.
yeah,
And then my good friend of mine, Mark Robinson, he manages the safe injection. They have like a van that goes around
yeah,
in PG and DC, and I know they're mobile.
yeah,
You're in a fixed site,
yeah.
uh, but I think it's a great beginning. I mean, I think you
Right.
guys are doing a great job, especially under the conditions that you guys started. I'm sure you'll just continue to, learn and adapt as the condition changes.
Yeah, I'm have the lofty, goal of kind of expanding, having maybe like some satellite sites across the county, and maybe like the regional service centers or something like that. So having staff positioned in those centers to kind of catch folks that are not able to, come to Rockville or something like that. And then still have that ability to kind of be mobile in a sense. And then I know there's been preliminary discussions with public health because I know they're setting up a mobile medical vehicle or something like that, in which we were looking to be able to have a staff person on that vehicle to provide SSP services, supplies, and things like that. So that those kinds of things may be coming down the pike soon, which we're working on. But we're always looking at how can we be more innovative to make sure we are covering all of our bases to catch as many clients that could potentially benefit from this type of service.
Right, right. And in terms of demographics, the Wheaton, Silver Spring area, do we do we do we have a lot of overdoses and IV drug users in that portion of the county?
Yeah, well, I know Down County has been hit pretty hard
It has.
as
Okay.
far as around that I would say the Silver Spring area, but just we all know it borders DC, of course. But then and then I kind of feel like we have a lot of people in the county that are very transient, so you can get anywhere you really want to get at any time, in a sense, almost in some of the more urban areas of the county versus the up county. So I will say that they have been, experienced a lot of issues around overdoses, um, a lot of, more so in the Silver Spring area. I have seen some in maybe Wheaton as well, but I think Silver Spring might kind of encompass most of what they've experienced, unfortunately. So we've done a lot of like every week every month what we do is we look at the heat maps that are provided by law enforcement,
Okay.
and work with our epidemiologists and HHS to kind of identify. We'll do like a census level review of data, and kind of identify the top 5 locations in the county that have been hit the hardest with overdoses. And then what we'll do is, for every week for that month, we'll focus in on those 5 areas and doing outreach in those different pockets of the county. Sometimes those areas don't necessarily vary from month to month. So we'll, continue to go and continue to train as many people as we can. In addition to taking Narcan, we also will carry fentanyl test strips and distribute those as well, so that people, who might be dealing with substance use disorder, or they know somebody who is, can provide them with the fentanyl test strip, so that they could actually test their substance before they actually use it. Unfortunately, when initially we were getting the fentanyl test strips, they didn't necessarily come with instructions on how to use them. So we actually had to create like a pocket-sized business card that has instructions on, how to actually use the test strip to test their substance before they actually use it. So, and then it has, connection to harm reduction services as well. So we, been very, intentional and creative of trying to, connect with people, trying to get them services that they may need. And I've seen a regular flow of clients starting to come into the program on a regular basis. And then the partnership that we've been able to establish with Tree of Hope, I think is going to be invaluable as well. With going into the homeless shelters together and providing those groups and connecting with those clients directly, just so that they, can be aware of what services are available and get connected. So.
Right, that's fantastic. Yeah, I know from talking to Mark and talking about the service, the syringe exchange in DC and PG, he was saying that when you get people to the point where they trust you and you see repeat customers coming back and coming back, then eventually when they're tired, they do ask for treatment, and you can provide wound care as another important component as you begin to help. And he even said if you could give them socks and stuff like that.
Yeah. And that's some other things that we're working on doing. So we bought blankets to give out to people, when engaging with them. Um We've recently, I was just telling my team, like, hey, we need to get into buying socks and buying other little, toiletry items that they may need, because you just never know. Hey, we might be the only person they talk to that day. So making sure that they have something, some kind of snacks or bottled water, different things like that. So we've been trying to be very creative and diversify the types of offerings we have when we're engaging with clients, potential
Right.
clients anyway.
That's great. That's the right attitude. And that's a great idea, having that little, instruction with the fentanyl strip. Because I know with the Narcan kit, inside the Narcan kit, it has the real clear instructions. Because in the jail, sometimes a person, I might train them and then they don't actually leave the jail for a year.
Yeah.
So when they actually get the kit, they don't remember what I excuse me, what I said a year ago. But when they open up the kit, it's very simple instructions with pictures.
Yeah.
And that's really smart, smart service delivery.
Yeah. I always tell people, I was like, if you've ever had to administer Flonase, then you can administer Narcan. Just because it's, it's a nasal spray. So, and we try to simplify, educating and training, as much as possible, just so, because in those types of situations, it could be very stressful. And so you might, forget a step. So it's just like making sure you just try to train people up as best as possible.
Right. Thank you. So look, Ben, we got about a minute left. In closing, is there anything you want to leave as a message for the public?
Yeah. Well, I mean, I will say that when a lot of times we may have like a I guess maybe like an uninformed view of what a person looks like who might be dealing with substance use disorder. And I would like to let people know is that, it could look like our neighbor. It could look like the person across the street is not the typical person you might have thought of, back in the day. So it doesn't have any socioeconomic status associated with it, no color, gender. Anyone can be impacted. Just recently, I saw that a professional football player overdosed thought he was using cocaine, which was laced with fentanyl. So any substances nowadays can be adulterated. Don't think that you can buy some kind of prescription medication off the internet, off of Twitter, Facebook, and Instagram, because a lot of that is adulterated as well. Because we've had an instance in the county where a person thought they were buying a Percocet off of Twitter and it ended up being fentanyl. So we just got to be more cautious and careful about the things we do, and making sure we educate our loved ones about these risks that they might be engaging in. So I think that might be the thought I will leave everyone with.
Right. Thank you. And thank you for gracing us with your time and your expertise, Ben. So this is James Sutton. My guest today was Ben Stevenson, the manager of harm reduction services here in Montgomery County for Health and Human Services. And this has been Road to Recovery. And I'll see you on the road to recovery.